Hello and welcome to a special interview for The Wire supported by Glenlivet Books. 5 days ago on Friday, a study was published which suggests that the total number of COVID deaths in India between the 1st of June 2020 and the 1st of July 2021 was not 400,000 cases as the government says, but somewhere between 3.1 and 3.4 million cases. And that's 7 to 8 times above the government's officially recorded and accepted figure. So today we ask, on what basis has this study come to this estimate? And perhaps equally importantly, what does this suggest for the Omicron wave that is presently raging through the country? My guest is the lead author of the study, Professor of Global Health and Epidemiology at the University of Toronto, and the Executive Director for the Center for Global Health Research, Professor Prabhat Jha. Professor Jha, as I said in that introduction, 5 days ago on Friday the 7th, you published a study which shows that total COVID deaths in India between the 1st of June 2020 and the 1st of July 2021 were between 3.1 and 3.4 million, not 400,000, as the Indian government's official figure puts it. In fact, it's something like 7 to 8 times more. So can I start by asking, would you explain the basis on which you come to this estimate?
Well, the basis of our estimate relies on 3 independent studies. Now, the preferred data, of course, would be if Indian death registration were complete, as it is in Canada or the UK or the US. But in fact, out of the 10 million deaths that occur, 1 crore deaths that occur in India every year, 3 million are simply not registered, and 8 million do not have a medically certified diagnosis with it. So in the absence of this information, we had to rely on alternative sources of data. So we used 3 studies. The first was a very simple idea. C-Voter is a very reputable polling company. I'm sure they've actually had some of their results posted on your program. And they conducted a survey asking about 140,000 adults all over the country, randomly selected by dialing them. So think of it as a true opinion poll. And they asked, has there been a COVID death in your house? And so we analyzed those data. And that showed that in the first viral wave, which was in September of 2020, there was a small increase. But by April, May of 2021, the big wave, there was more than a doubling of the death rates of overall death rates because of COVID. And then we did a sub-study looking at 57,000 households to look at more detailed information on whether it was COVID or not COVID deaths. And the increase was seen in both, just very much suggesting that in a pandemic, the big increase in deaths that occurs is very much due to the main infection, which in this case was COVID. So that was one source. The second was the government of India's own data from about 200,000 hospitals, which is collected by the Ministry of Health and Family Welfare. And so they track how many deaths occur every month. And so we compared the monthly totals for 2020 and 2021 to those reported in the same hospitals in 2018 and 2019. And that showed roughly close to a 30% increase in overall deaths. And the last source of data on which many journalists have reported is the civil registration data. But in this case, we confined it to only 10 states that have had good data for at least 10 months. So you can study the periods in between the waves. Now, what's interesting is all 3 of these data sources point to a very consistent conclusion. Somewhere between 25 to 32% of excess deaths occurred in that time period. So since India has roughly 1 crore deaths, 10 million deaths, you multiply that out and you get our working estimate of about 3 million deaths that occurred in that time period.
I take it you're pretty confident that that estimate you've come out with, 3.1 million to 3.4 million, is one that you're pretty confident, certain of.
Well, in science, you should always be doubtful of your own research, and we were very careful. We used conservative estimates. For example, the government's data was only released up till May of 2021. So we're not even including June, in which, as we all know, the deaths had continued. So if you put all of this together, it is a conservative estimate. Other scholars that have studied the topic have come to similar levels. So that gives us some confidence that we're not some outlier, that the estimate is very consistent with a vast underreporting of COVID deaths in India during the pandemic waves.
One of the astonishing things is that of those 3.1 to 3.4 million deaths, 2.7 million happened in just 4 months, April, May, June, July 2021. Those were the 4 months of the devastating second wave. So what your study shows is that that second wave took a far greater death toll than anyone realized at the time.
Oh, absolutely. And we don't quite know the reasons why the second wave was more deadly than the first. It could be related to it being more of the Delta variant. It could be related to other factors, one of which you've already identified, that the second wave was both a rural and urban phenomena. The first wave was probably limited to some urban areas. And since most of the deaths in India occur in rural areas, then that wouldn't be surprising. You'd see a huge increase. And I do want to say that we epidemiologists study these statistics, and we try to do it dispassionately. But each of these deaths represents not a statistic, but an actual human and all the families suffering behind them. And case in point is, yeah.
It's very important to remember that these are not statistics. These are actual human beings whose lives were cruelly cut short. And they also have members and family members and loved ones who've suffered as a result. But let me make one further point. India's official COVID-19 death count, as of yesterday, is just under 485,000, which suggests a death rate of 346 per million. Now, that is 1/7 of the US death rate, although the United States is just 1/4 the size of India's population. Your estimate pushes up the per million death in India to somewhere between 2,300 and 2,500, which is very similar to the American figure of 2,579 per million. Is that in a way confirmation of your study?
It is, in the sense that many of us, me included, thought that there was some peculiar Indian paradox in the first viral wave, that we saw large prevalence of infection, meaning some of the surveys showed that 80% of the urban population was already infected, but there were a few deaths. In retrospect, when we look at the data, it is explained by both missing and undercounted deaths and where we studied the disease. Now, once the disease has spread across the country, then there was no exceptional India, that India's death rates look very much like what happened in Brazil or Colombia or the US. So that is partial confirmation, but you always need local evidence, which is what we tried to do here. You can't just take Western data and impose it onto Indian patterns. That usually gives you wrong conclusions.
But inherent in that answer you gave me is a very important point, and perhaps also an admission. A lot of people felt, until studies like yours began to emerge, that there was something exceptional about India, and the COVID death rate in India was significantly lower than it was in other countries. And many people said, maybe there are special circumstances that explain it. I believe you even believed that at one point of time. But now I take it your study has conclusively proven that actually the true death rate in India was much higher. It was misleading to believe that India's death rate was lower, and the belief, therefore, that India was in some sense exceptional was mistaken.
Absolutely. And I think we have to recognize when we're wrong in science, otherwise you don't move forward. And I do think of these data as, in a way, as a key pillar of how India and other countries fight the pandemic. So just think of the analogy that if you send your child to school on a school bus, you would be very happy if the bus driver was vaccinated, wore a mask, and had been tested. But you wouldn't be happy if they put a blindfold over their eyes and said, I'll figure my way out. And that's effectively what many governments have been doing, is ignoring the data and saying, we'll figure out how to get out of the pandemic. And these data are not just relevant for as some form of justice for all of those 3 million individuals that died. They're a blueprint for figuring out how India and other countries get out of the pandemic.
Absolutely. But let me ask you one more question. And again, I'm picking up something that was inherent in your earlier answer. How does the estimate that there were a total of somewhere between 3.1 and 3.4 million deaths in India compare with, say, the death rate in a country like Brazil, which in many ways is similar to India? We know that it compares now very comparably with the United States. How does it compare with a country like Brazil?
Is very similar, and in Brazil has had also not just two big waves like India has, but several waves, and it has a different pattern of infections. For example, the local variant, the gamma variant, certainly the beta variant, was actually quite common in Brazil. So what it does suggest is, because Brazil does a reasonably good job of capturing all the deaths, then you can use the official data. That's not so in India, where the deaths remain under-registered, particularly in some states like Bihar and UP. The vast majority of deaths are not even registered. So in that context, it is a suggestion that there's a real need to improve the simple death accounting systems that occur in India, not just for COVID, for all other diseases. Without a GPS of health, you don't know where you're going. And these data provide that kind of information, or a roadmap to better health.
Now, there's no doubt that actual COVID deaths in probably every country of the world have exceeded the publicly made available official tally. But in the case of India, is the gap and the disparity considerably greater than it is in most other countries?
Oh, absolutely. And there's certainly undercounting, including in the US, but that's estimated in the range of perhaps 10 to 20%. In Canada, we're reasonably good. We're very slow, but we're reasonably good. So there's limited undercounts. And when these deaths occur, the statistical systems, the registrar generals, have some challenges, like does the healthcare, to count these deaths, but they caught up very quickly in most of these settings. In India, the undercount is substantial. And for this reason, the World Health Organization, when they first made the estimate of global deaths, didn't include India. Now, in the updated estimate, they will include India using these indirect sources. And these totals mean that the worldwide totals of about 5 million deaths now need substantial revision. It's probably much, much higher than that.
You made a very important point that may not be known to my audience, so I'll repeat it with your permission. When the World Health Organization first made its estimate of global deaths, they didn't include India because they didn't believe the accuracy of the figure being made available. That is essentially why they didn't include it. They didn't trust it.
They didn't trust it, and they didn't think that the death reporting was complete enough. Now, using secondary data sources, they will make an estimate. I understand that the Indian government has been very reticent about letting these numbers come out, but I think that's actually a mistake. The data are never political in one way or the other. They're apolitical, and they help eventually do the right things for the country. So counting the dead is going to help the living. It's not simply an exercise about the past.
You know, in an article written by John Cohen on your study in www.science.org, you're quoted as saying, and I'm quoting you, the Indian government very much is trying to suppress the numbers in the way that they coded the COVID-19 death. Could you explain that a bit further? Because the audience in India would really like to understand what sort of suppression is happening and how it can be pointed out and detected.
Well, I think John slightly misquoted me there. I think the key point there is the World Health Organization suggests that COVID can be reported as a cause of death if you have biologic or microbiologic confirmation, but also if you don't. So many states in India are not reporting suspect COVID deaths. They're only reporting those that have had a PCR or rapid test positive. Now, other settings, like in Canada, we report both confirmed deaths, meaning they were tested and confirmed, but also obvious COVID deaths. So case in point is in a nursing home, if you have one person die and they are confirmed COVID, and in the next bed, 2 days later, another person dies of an acute fever or respiratory distress, it's almost certain that that was also a COVID death, even if that second person wasn't tested. So this has been some of the weaknesses, is that the death registration process in India has been slow and also uneven at the state level. You put all of that together and it does lead to the scenario where WHO and other outside experts would not trust the Indian numbers. But there is an opportunity for India to improve its numbers going forward.
Again, what you're saying, and I'm repeating it so that the audience can understand it in simple English, you're saying for very technical reasons that a person died but wasn't tested before his or her death to have had COVID, that death is not counted as COVID, even though the person may have been clearly infected and it's only obvious to conclude he or she was. So on very technical grounds, the Indian government is deliberately maintaining a low COVID tally.
Well, I think all governments are scared of these data because they think it'll be embarrassing. But if you actually bring out the numbers in as close to the truth as you can, it helps with the response. It helps to plan what might be done for Omicron. It helps to understand how many oxygen tanks and ventilators and ICUs might be needed. So there's natural reluctance to have any kind of shocking figure come out. But I think once it does, it actually does improve public health practice. And we've seen that, for example, in the case of malaria in India. The Indian government did not like the estimates made by one part of the government, the Registrar General, some years ago, that there were 200,000 malaria deaths, and protested very vigorously. But it also then took up serious malaria programs in Orissa and other places. And that's been a spectacular success. Now, malaria deaths in India have declined in an extraordinary way. And that started by recognizing the problem. If you don't recognize the problem, you don't act on it.
Absolutely. Accepting the truth of the death tally helps enormously, not just in planning, but in also knowing what facilities are needed thereafter. But we're coming to the end of this interview. And let me, before I end, look a little forward. Does your study have implications for the Omicron wave that is raging through the country at the moment? We've had 194,000 cases reported on Wednesday morning. Most people, however, believe that the disease will be mild and deaths will be far fewer than in earlier variants, because this is what they've been told is how Omicron behaved in South Africa and how it's behaving in the United Kingdom. On the basis of your study, do you share that optimism, or does your study give you reasons to be more doubtful?
I think we have to be really careful. There's no such thing as mild Omicron. It's a bit like the cigarette industry wanted to tell you cigarettes were mild or menthol, and they ended up not being true. So remember, Omicron appears to cause less disease in individuals, meaning it's mostly confined to the upper respiratory tract, not the lower respiratory tract. So that's good news. However, it's more transmissible than other variants. So it's not mild in that sense. And the concern for India, as the concern is worldwide, is simple. If you have so many more people infected, even a smaller fraction of those getting sickened could overwhelm the healthcare system. And that's, quite frankly, the challenge we're facing in my city, in Toronto, today. We've had record numbers of people admitted to hospital. Many of them have very mild disease, but nonetheless, you've got serious illness or serious numbers of cases. The other concern, which will also be affect India, is if the healthcare workers get sickened, they might have reasonably low-grade disease, but they have to isolate. So who's going to run the hospitals? Who's going to run the clinics? So there's a few really tough weeks ahead. I'm sure it will come down, as you've shown some evidence from Bombay that it is coming down, and in London it's coming down. But it's a few very rough weeks ahead. And as part of that, having good systems that track how many deaths occur from the Omicron wave would be part of understanding, are things actually getting better?
Does your study also suggest that just as there were a large number of unrecognized, uncounted deaths during the Delta wave, there could be something similar for Omicron, although perhaps the numbers may not be so huge, but there could still be a substantial number of unrecognized, uncounted deaths this time around as well?
I think our study has removed this idea that there's some kind of exceptionalism or Indian paradox. So if Omicron is going to kill in large numbers simply because there's so much of it, then India will also be affected. And it does suggest having good systems in place to be able to understand the deaths and know what that means in terms of oxygen tanks and ventilators and hospitals and staffing to deal with the pandemic. Many people who died in the April to June wave of last year could have been avoided, many of those deaths, simply by very basic things like oxygen or short-term ventilator support. So hopefully this time India will be far better prepared for that eventuality if it occurs.
Finally, on the basis of your study, what would be your advice to the Indian authorities to ensure that they are better able to account for and to calculate for COVID deaths? What are the steps you think they need to take so that we don't have this huge 7 times greater number of actual deaths compared to officially acknowledged ones?
Well, there's 2 simple steps that could be done. First is, well, 3, in fact. One is follow the WHO guidelines on how to code COVID deaths. Don't ignore suspect COVID deaths. The second is the Registrar General has a very good demographic system called the sample registration system, which in about 1% of the country surveys deaths every 6 months. Those systems have not reported since 2018, and that can be restarted. But the last one is also a simple suggestion. Given the calamity from COVID, the forthcoming census, I think now planned for September 2022, could add a simple question. Was there a death in this house in 2020 or 21? And if so, the age, sex, and date. And having those data available would give you an exact accounting of the excess deaths that occurred in the pandemic. And I think it would be poetic justice to actually have the government know the names and the dates of death of all the people who might have died from this terrible tragedy.
The very last point you made reminds me of something one of your colleagues on your study, Chinmay Tumbe, has written about. He said that India only found out the actual number of deaths during the Spanish flu of 1918 when the census was done a few years later.
Yes.
Not suggesting that we will only know the full truth about COVID-19 deaths if that critical question is included when the census is done later this year.
I would very much hope that the Registrar General, Mr. Joshi, and other officers would consider that suggestion seriously. I think it's also a good example of where India can lead. India is the inventor of the zero and has transformed mathematics. So here's a chance for India to say, we will take a direct account of the deaths that occurred from COVID. And that's a shining example for many other countries to do. So that might sound a bit naive, but I remain optimistic that the Indian government and Indian society will do the right things as a fair accounting of this terrible, terrible tragedy that's befallen the country.
Thank you very much, Professor Jha. I hope the Registrar General, and in particular, I hope the government are hearing you, and that critical question is included in the census, because not just for the sake of posterity, but also as a duty to the Indian people. The government must make every effort to establish how many people died. And those who died, the least we can do is to acknowledge the number accurately. I thank you for this interview. Take care.
Thank you.
Stay safe.
Thank you.